A very good morning, students. Now this video is for the dissection of the right atrium. This is the right auricle is here, which is overlapping to that of the ascending aorta here, and then partly it is also overlapping to that of the pulmonary trunk. Then you will see that from this auricle, this is the chamber of the this is the complete right auricle is seen here. This is the opening of the superior vena cava above, and here you can see this is the opening of the inferior vena cava. So all this part is the right atrium, which also forms the right border of the heart. Okay, right border of the heart. What to expose this, the inner aspect of this right atrium? Okay, what I will do is that I will give a cut here. Okay, leaving this right auricle as such, okay, from superior to the inferior border, then it will turn it towards that of the right side, right here, there, right up to this sulcus which you are seeing here. A faint sulcus is seen here, extending from the superior vena cava just anterior to that of the inferior vena cava. This is a sulcus and it is called as the sulcus terminalis. Okay, so we will see it as the crista terminalis. The same sulcus terminalis will correspond to the crista terminalis inside the chamber. So this is the slightly abnormally dilated the right atrium, and then I just give a cut here to that of the right atrium wall here anteriorly. Okay, I will not go through this auricle here. Okay, just I am giving a cut here. Right up to the inferior border, and then we'll give a cut here in the superiorly right up to the superior vena cava here. Okay, we'll show you the opening of superior vena cava, and we'll give a cut here right down near the inferior side. Okay, and then we'll reflect this onto the right side, and then we will see that there is the junction of the smooth and the rough part will be seen here. See this? This is the cavity of the right atrium. This is the crista terminalis. This is the crista terminalis, and then this is the rough ridges musculi pectini, okay, or pectinati. This is the crista terminalis, and beyond this there is the smooth part of the right atrium is seen here. Okay, it is the smooth. This is the auricle. Okay, this is the cavity going inside the rough part inside that of the auricle. Okay, now we will just clean it and we'll see the various structure. Okay, the anterior wall we have seen, it is rough musculi pectinati, and this is the crista terminalis, and then the rest of the area, the posterior wall of the right atrium, it is all is the smooth part. This is derived from the venous part of the heart tube. Okay, the sinus venereum part. Okay, and if we see the structure into the posterior part, we will see that there is an interseptal part. I will just extend this incision so as you can see the septal part properly. Okay, which is not seen properly here. Now this is the opening of the inferior vena cava. I am just going superior to the opening of the inferior vena cava, which is abnormally dilated in this case. Okay, and then I will show you this. This is that septal part of the right atrium. Okay, this is septum of the right, interatrial septum, what is called as. And in this interatrial septum, you are seeing a depression, a oval depression, what is called as the fossa ovalis. So this is the fossa ovalis part is here, and this is bounded here by the that is a ridge here. This is bounded by the ridge, and this is the annulus, okay, and that is the representative of that of the septum secundum. The fossa ovalis itself, it represents the septum primum, okay, septum primum. So this is fossa ovalis, and annulus is here, which is surrounding to it, which is representing the septum secundum is here, and this is very close to the opening of the inferior vena cava, okay. So this was the opening of the inferior vena cava is here. This is the opening of the superior vena cava is there, and this superior vena cava opening is not guarded by any wall, but the inferior vena cava opening is definitely must be guarded by the wall. Let me just search it, because that extension, yes, there is a wall here, okay, which just guard the opening of the inferior vena cava, which was here in this wall, okay. I am not getting the wall, but otherwise in any other heart I will show you there lies a wall which prevents the regurgitation of the blood going back into the lower half of the inferior vena, in the lower half of the body through the inferior vena cava. Now there is no wall. Then there is another opening seen here, and this opening is that of the opening of the atrioventricular wall. This is the right atrioventricular wall, and this is again an abnormal dilatation of this right atrio, where you can see the three cusps guarding the dilated right atrioventricular wall. Then we should see the opening of the coronary sinus, and this is just below that of the opening of the inferior vena cava. You can see here, there is just, I will pass the probe inside this. See this. This is the opening of the inferior, I mean say coronary sinus, which brings the blood from the almost the whole of the heart, and this is guarded by a very thin wall here. You can see this is the wall of the, in the tip of my forceps I am catching this wall, and this is the wall of the coronary sinus, okay, crescentric in shape. This is the wall. So there are three major openings: superior vena cava, which will bring the blood from upper half of the body. There will be the inferior vena cava opening here, okay. So this was the inferior vena, which should have been guarded by a wall, okay. That is gone. And then in the septal part of the interatrial septum, this is the fossa ovalis, okay, annulus, which is guarding to this fossa. And then there is the third opening of the venous opening is that of the coronary sinus. You can see here this venous opening of the coronary sinus, and it is guarded by a rudimentary wall here, okay, this wall, crescentric valve is here. And then there is a flow. So from these three openings the blood will come into the right atrium, and then it will be pushed towards the atrioventricular wall into the and will go into the right ventricle, okay. So this is the part of the interatrial. Then the whole of this structure is smooth, which is the posterior part. Anterior wall of the right atrium is rough, okay, with this musculi pectinati and the crista terminalis here. This completes the dissection of the right atrium. Thank you very much for watching this video.